Well, I studied and graduated from the Southern California College of Optometry in 2005. I completed a residency in ocular disease with the Indian Health Service, and that was in Crown Point, New Mexico. And then from there on, I did some background. I worked in Indian Health for the last 8 years in northern Arizona. So a lot of ocular disease, a lot of diabetic eye disease.
So tell me a little bit about those two diseases.
So with ocular disease, we're dealing with anything from foreign bodies to anterior segment, meaning something that's affecting the front of the eye, and then trauma. We had a lot of trauma in such a rural area. And then with diabetic eye disease, we're dealing with diseases that's caused by diabetes. So a lot of that's more of the back of the eye and the retina. So we'll see some swelling that affects the vision. We'll see some bleeding and stuff like that. So it's a really good way for us to do a non-invasive look at how the blood vessel system is doing in a diabetic patient.
Are you seeing that here in Pahrump too as well?
Yes, we do.
And when a person comes in for something like that, do you find that in their regular checkup, or are they having symptoms beforehand?
Sometimes they're having symptoms, but sometimes we do find the bleeding and stuff that's not causing much symptoms just on a regular checkup.
And a regular checkup should be done how frequently?
Every year.
And for contacts and glasses?
Yes, ma'am. So we do have a dispensary here, and we have a wide range and selection of glasses. We actually are getting some new inventory in by the end of this month, and we're going to be having a huge trunk show on November 15th here at the office.
All right. And what's that about?
Well, the trunk show is we're going to have a lot of inventory in, some special vendors coming in with their inventory, and we're going to be able to offer glasses at a discounted rate.
Oh, really?
Yes.
So people should make an appointment, or should they just come in and see them at that point?
We will have appointments that day, but it's actually going to be come walk in. You can come in to browse our frames because this is for you to buy the frames at a discounted price. And these are like name brand frames and stuff. So a lot of good inventory coming in.
Is that all day long?
It'll be all day long, actually. I believe starting from 9 and ending at 5. I really enjoy pediatrics, and actually October is Pediatric Vision Month. So if your child hasn't had their eye exam yet, even if you think they're seeing fine, please bring them in for an exam because we're able to check how the eyes are functioning and working together, as well as the health of the eye to make sure that vision will develop normally.